Today, we explore why beta blockers might not be the best first choice for older adults. For over 50 years, doctors have prescribed medications like Metoprolol and Atenolol to treat high blood pressure in senior patients. Many older individuals rely on these common pills daily, trusting them completely to manage their rising blood pressure levels safely. However, recent medical studies reveal that these traditional treatments might not be the optimal solution for pure hypertension without complications. The famous ASCOT trial completely shifted our understanding of how these older medications affect the cardiovascular system over long periods. Researchers discovered that prescribing these older drugs as a primary defense for simple high blood pressure is largely outdated now. If you do not have underlying heart conditions, and relying solely on this specific medication class could actually cause hidden harm. Let us examine the negative impacts closely, starting with profound fatigue and significant limitations on your daily physical mobility levels. These medications work by blocking adrenaline, which prevents your heart rate from increasing naturally when you engage in physical activities. As a direct result, you might feel exhausted incredibly fast while walking, climbing stairs, or performing simple daily exercise routines. Your body simply cannot pump enough oxygenated blood to your working muscles during these moments of increased physical exertion demands. This artificial heart rate limitation makes maintaining an active lifestyle extremely difficult and frustrating for many healthy older adults today. Beyond physical fatigue, when we must urgently discuss the severe metabolic disturbances associated with long-term usage of these specific pills, scientific data shows a concerning increase in insulin resistance among patients taking these medications for their chronic high blood pressure. Furthermore, blood tests frequently reveal elevated triglyceride levels, which significantly increase your overall risk of developing serious cardiovascular disease complications. Most alarmingly, patients face a 22% higher risk of developing type 2 diabetes when using these specific drugs. This elevated diabetes risk presents a massive health challenge, turning a simple blood pressure treatment into a complex medical problem. Doctors are now recognizing that trading one cardiovascular risk factor for another metabolic disease is simply unacceptable in modern medicine. Another critical danger involves the increased risk of sudden falls, which is particularly devastating for our vulnerable elderly patient population. These drugs frequently cause orthostatic hypotension, meaning your blood pressure drops dangerously low the moment you stand up too quickly. This sudden drop creates severe dizziness and disorientation, making you highly susceptible to losing your balance and falling down hard. For seniors, a simple dizzy spell can quickly result in catastrophic hip fractures or traumatic brain injuries requiring emergency surgery. The recovery process from such severe fall injuries is notoriously long, painful, and often permanently reduces your overall life quality. We must prioritize treatments that do not compromise your stability or put you at risk of these devastating physical injuries. Fortunately, modern medicine offers excellent alternative solutions that provide superior cardiovascular protection without these dangerous physical and metabolic side effects. Calcium channel blockers, such as amlodipine, represent a fantastic modern alternative for managing hypertension safely in our older patient demographics. These specific medications relax your blood vessels effectively, allowing your blood to flow smoothly without artificially suppressing your heart rate. Another excellent option includes ACE inhibitors like lisinopril, which protect both your heart and your kidneys from long-term damage. Medications like losartan also fall into this highly recommended category, offering powerful blood pressure control with minimal metabolic side effects. These modern alternatives actively preserve your natural energy levels, allowing you to exercise comfortably without experiencing that debilitating sudden fatigue. They also maintain your metabolic health safely, ensuring your blood sugar and cholesterol levels remain perfectly stable throughout your treatment. Switching to these newer medications can dramatically improve your daily quality of life while keeping your blood pressure perfectly controlled. However, we must issue a very urgent and critical warning regarding your current prescription and any potential changes you desire. You must absolutely never stop taking your current medication abruptly without direct medical supervision from your trusted primary care physician. Quitting these specific drugs suddenly can trigger a dangerous rebound effect, causing your blood pressure to spike to lethal levels. This severe withdrawal reaction can easily precipitate a massive heart attack or induce fatal cardiac arrhythmias within just a few days. Your heart becomes hypersensitive to adrenaline after long-term use, so sudden removal causes extreme stress on cardiovascular tissues. And any transition to a new medication must be done gradually, slowly tapering off the old drug under strict medical observation. If you have been taking the exact same blood pressure pill for over 2 years, it is time for review. Medical guidelines evolve rapidly, and what was considered perfectly optimal 3 years ago might be completely outdated and harmful today. Schedule a dedicated appointment with your doctor specifically to discuss your current hypertension management strategy and explore better modern alternatives. Prepare for this appointment by documenting any instances of fatigue, dizziness, or unusual weight gain you have experienced recently at home. Ask your physician directly if a calcium channel blocker or an ACE inhibitor might be a safer choice for you. A good doctor will welcome this proactive conversation and carefully evaluate your unique metabolic profile and personal cardiovascular health history. Together, and you can create a safe transition plan that protects your heart while simultaneously preserving your precious mobility and energy. Understanding your medications is the first crucial step toward taking absolute control of your long-term health and personal well-being. Knowledge empowers you to ask the right questions and demand the highest standard of medical care from your healthcare providers. Do not accept chronic fatigue or dizziness as a normal and unavoidable part of the natural human aging process anymore. You deserve a treatment plan that allows you to remain active, energetic, and completely independent throughout your golden retirement years. Let us review the key takeaways from today to ensure you fully understand how to protect your precious cardiovascular health. First, remember that older generation drugs might not be the absolute best starting point for simple high blood pressure anymore. Second, and be highly aware of how your body reacts during physical exertion and note any unusual limitations in your stamina. Third, monitor your routine blood test results closely, paying special attention to your fasting glucose and your triglyceride lipid levels. Fourth, take dizziness seriously, especially when standing up, as this is a major warning sign of dangerous orthostatic blood pressure drops. Fifth, educate yourself about the newer, safer alternatives available today that offer superior protection without compromising your vital metabolic functions. Sixth, and most importantly, never alter your medication schedule or dosage without having a detailed consultation with your prescribing doctor. Your health journey requires a collaborative partnership between you and your medical team, built on open communication and mutual trust. Yet do not hesitate to seek a second professional opinion if you feel your current doctor dismisses your valid medication concerns. Patient advocacy is incredibly important, especially when dealing with chronic conditions that require lifelong management and daily pharmaceutical intervention strategies. By staying informed about the latest medical research, you can make smarter decisions regarding your personal health and wellness goals. We hope this detailed explanation has shed valuable light on a very common but frequently misunderstood aspect of senior healthcare. Share this vital information with your older friends and family members who might be struggling with similar blood pressure medications. A simple conversation about their daily pills could potentially save them from a devastating fall or an unexpected diabetes diagnosis. Awareness is our strongest weapon against outdated medical practices and the hidden dangers of long-term pharmaceutical side effects today. Always remember that your body gives you subtle warning signs when a specific treatment is not working harmoniously with it. Listen to those signals carefully and trust your instincts when you feel unusually tired or dizzy during your daily routines. Modern pharmacology has advanced tremendously, giving us highly targeted therapies that respect your body chemistry and preserve your overall vitality. Embrace these medical advancements and work diligently with your healthcare providers to optimize your daily regimen for maximum health benefits. High blood pressure is a serious condition, but managing it should never cost you your mobility, energy, or metabolic stability. You have the power to demand better treatments and achieve a healthier, more vibrant life free from unnecessary drug complications. Stay proactive, stay informed, and always prioritize your holistic well-being when discussing any long-term treatment plans with your doctor. And thank you for joining us on this deep dive into the complex world of hypertension management and senior cardiovascular care. We are deeply committed to bringing you the most accurate and up-to-date medical information to empower your choices. Please subscribe to our channel for more insightful health content and practical advice for navigating your medical journey safely today. Thank you for watching, and we will see you in our next informative video about your personal health.